Wound care is often reduced to choosing a dressing and changing it on schedule. Over time, it can feel repetitive and routine. But in nursing practice, wound care is never just about covering tissue. It is about protecting healing, preventing infection, and recognizing when something is going wrong. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students believe wound care is about memorizing dressing types and following orders. In reality, effective wound care begins with assessment. Nurses must understand what kind of wound they are dealing with, what stage of healing it is in, and what factors may slow or prevent recovery. Think of wound healing like repairing a road. If the foundation is unstable or water keeps entering, placing a new surface will not fix the problem. The body heals wounds the same way. Oxygen supply, circulation, nutrition, and infection control all determine whether tissue can recover. At the bedside, nurses assess wounds carefully. They observe size, depth, color, drainage, odor, and surrounding skin. Pain, temperature changes, and delayed healing often signal complications. These observations guide dressing choice and frequency of care. Different wounds require different approaches. Surgical wounds, pressure injuries, diabetic ulcers, and traumatic wounds heal in different ways. Moisture balance is critical. Too much moisture damages tissue. Too little dries the wound and delays healing. Dressing selection exists to support the body's natural repair process, not to force it. In healthcare settings, nurses are central to wound prevention and management. Regular repositioning, skin inspections, pressure relief, and patient education reduce wound risk. When wounds do occur, early intervention prevents progression and infection. The nclex tests wound care by focusing on assessment, prevention, and safety. Questions often ask which action promotes healing or which finding requires intervention. The correct answer usually reflects protecting tissue and preventing complications rather than choosing a specific product. In real nursing practice, wound care is ongoing. Nurses reassess wounds over time, adjust dressings based on healing progress, and communicate concerns to the healthcare team. Documentation plays a key role in tracking changes and ensuring continuity of care. Now that you understand wound care as a process guided by assessment and healing principles, the next step is learning how nursing care changes across different age groups, where skin integrity and healing respond very differently. That comparison becomes clear in pediatric and geriatric nursing, and that's exactly where we'll go next here at the Learning Studio.